My name is Shtern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. Dr. Mitchell Sokolov of UMass will describe recent advances in patient care. The main topic of my presentation is our prostate cancer equity program and its mission to bring the cutting-edge advances in patient care to Massachusetts men and eliminate health disparities. Prostate cancer equity program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education and research, and clinical care equity. We are grateful to the Worcester delegation to the State House who made this program possible. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. This program was initiated since 2013 in collaboration with multiple organizations and has 4 components: public awareness, community education, prostate cancer equity and clinical care, medical education, and research. Our public awareness campaign, community education and outreach, is focused on the most vulnerable and underserved individuals. Since January 2023, we reached over 15,000 underprivileged individuals. This is a 50% increase compared to what we reported last year. Since 2019, our public awareness and education program reached over 52,000 people. For public awareness and education, our messaging is centered on the importance of screening and early detection critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive at the same time. The center of our medical education is AdMeTech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 7th annual conference took place in September last year. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices and research priorities. Last September, we had over 300 physicians participating during this event. After the event, our media partners published over 60 scientific presentations and reached over 35,000 physicians across the globe. It's difficult to find any corner of the world that has not been reached by this event. Our summit showed that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now, with so many novel diagnostics and therapeutic approaches, ensuring high quality, personalized, precision patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care to all. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older can participate. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion, in-person or virtual visits. We strongly believe that our prostate cancer equity program, integrated with our large-scale public awareness campaign, has been placing Massachusetts in a strong position to become the first state in our country to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of their families and friends. This process consists of three components. One, AdMeTech Foundation's team members collect basic information and match individual patients' needs with the appropriate state's experts for clinical care. Two, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, any insurance, and financial assistance if needed. Three, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as testing or treatment. I'd like to share with you a few recent examples of how Prostate Cancer Equity Program has been making a difference. This is a case of a Black man with a history of prostate cancer who is currently being treated. In mid-May, on May 15th, his doctor informed him that his scheduled treatment could not be provided due to problems with his insurance coverage. This man got upset and shared his situation with Representative Bud Williams, chair of Legislative Black and Latino Caucus, and a leader of the Men of Color Health Awareness, or MOCA, our community partner in Springfield, who referred him to us. On the late afternoon of May 26 last year, right before the Memorial Day weekend, he contacted us and appealed for help. Our primary goal was to restore his treatment as soon as possible, and we immediately reached out to Dr. Mitchell Sokolov and his team at UMass and secured their support. On May 30th, right after Memorial Day, UMass Urology provided guidance to this man how to address his insurance issues. By Friday the same week, on June 2nd, about 1 week after he came to us, the insurance issue has been resolved, and the appointment with Dr. Sokolov was scheduled at the earliest opportunity in early July to resume his treatment. The following Monday, on June 5, a MOCA leader heard about what happened and asked for a second opinion for his own urologic health issue and received an appointment with a leading urologic expert within a few days of his request. Another Black man, an immigrant from Africa, was referred to us by the Community Health Awareness Network Growth Equity, or CHANGE, our community partner in Worcester. This man, who was at risk of prostate cancer, had no insurance. We appealed to Dr. Sokolov's team and you must obtain a mass health insurance for him within 24 hours and organize consultation with Dr. Sokolov within 2 weeks. Dr. Sokolov recommended biopsy and further care. Emma Couillard serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Greg McClay, a patient educator, and other members of the AdMeTech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, and other clinical partners to expedite medical visits and address any needs you may have. Our team may not be able to right every social wrong that cannot be resolved by federal or state government, or provide perfect solutions for every man. And yet, we are committed to doing our best and making sure men are not left behind or struggling alone. If you have any questions about our program or need assistance, please contact Emma by phone, 617-523-3535, or by email, coordinator@admetechfoundation.org. Thank you for your attention.
Hi, everyone. My name is Emma Couillard, and as Dr. Shtern said, I'm the manager of the Prostate Cancer Equity Program. So if you call us, I'll be the first person you'll be speaking with. Our program supports men through every step of their medical journey and works towards eliminating health disparities. And our goal is to make it so you are informed and educated and empowered to make the best possible decisions about your life and your health. This program is important because so many social and health inequalities are determined by things that are outside of individuals' control, and this leads a lot of people to not be able to live healthy or long lives in ways that are really unjust. So this program tackles all that head on, so you don't have to deal with scheduling, translation, transportation, insurance, or any of the annoying parts of the healthcare system. I handle all that for you in coordination with patient navigators at institutions, and we don't want any of those things to be a barrier to you when you're trying to seek care for something that can be really scary and challenging. So now that you've heard a little bit about the program, I'll just end with a call to action to anyone who's listening. If you have any questions or concerns about yourself or your family or any of your friends, please reach out to me. I stand ready to help you in any way that I can. Thank you so much for listening.